Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And in this week's Ask Dr. Pane segment, we have a viewer from Twitter asking us a question about a facelift procedure. Dr. Pane, they're asking, would fillers or a facelift fix their sagging and caving cheeks? And Dr. Pane, you've seen the picture. What do you recommend?
Yeah, this is a good question. Now, let me describe the picture. This is a thin lady. She doesn't give her age, but she looks like she's probably in her mid to late 40s. Previous smoker, but doesn't smoke any longer, and is worried about sagging of the cheeks and caving of the cheeks. Now, when I look at her, I don't see a lot of sagging that she's describing. Now, there's a number of things that can be done here, and you're going to get different answers depending on who you see. The way we approach it is somebody does not have obvious real sagging skin. Now, again, we're in South Florida. If you go to enough consults, you're going to get offered pretty much whatever you want. Whether that's the right thing or not depends on a couple of different options. A lot of times it's who's seeing you and what you're telling them and all that. But what I see when I look at this lady, if she's really interested in doing surgery and wants to do a facelift and is pulling back the cheeks and everything, there is some room for that improvement. But she could do less because she's really not far enough along age-wise for that. So there are non-invasive things that can be done. There's various radio frequency skin tightening procedures that are non-invasive. Fillers are the ones that are off the shelf, are a good option here. They can restore volume. They can help with the lines. They are temporary, so they last varying amounts of time depending on what material is used for which area of the face. Again, could be a good option depending on what she wants to do. Laser is also an option here. That will tighten the skin and work on the fine lines and gives basically a lifelong benefit, has a little more upfront recovery, and again, not invasive in the same way that the facelift surgery is, but also a good option if that's what she's looking for. And fillers with a more long-lasting option, say fat, can be done if she has areas that she might want to do some liposuction. Sometimes you could do a combination procedure. Hey, I want to do lipo of the belly and sides, by the way, and why don't we do that instead of doing an off-the-shelf filler that will go away? We can combine it with a fat transfer to the face. Again, these are all possible options. There's not an exact right answer for her. Rather, it's a matter of what are the priorities, what kind of procedure is she looking for, and again, what's the background of the person seeing you. In our practice, we do all of these things that I've just described, which pretty much covers the gamut of what can be done. There's not really much else there. But if you see somebody that only does fillers or only does surgery, you may get some different recommendations. So oftentimes with the face and a younger person, it's a good idea to get a couple of consults or do enough research where you feel you're going to be comfortable getting some recommendations and getting the procedure that's going to offer what you're looking for, and also with the kind of commitment you're looking for. Again, if you want something non-invasive, more invasive, whichever. And that will give you the best chance of getting what you're looking for, and hopefully a result that's going to give you a good, lasting improvement.
Excellent. Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page, website, Twitter, or Instagram account. And Dr. Pane, we'll see you on the next question.
Great. Take care.